Hello, Kim.
Good morning, Reena.
Good morning. It's so nice to talk to you. I've been really wanting to do this, and I'm really honored. I'm so happy.
Mm.
Great. I wanted to ask you about self-stimulatory behaviors because that's the major chunk parents come to me with, and they want to know how to stop self-stimulatory behaviors. So I wanted your insights for parents.
Thank you for such a important question. Challenge with this question is that there is always a reason for the behavior. That these are not random, self-stimulating behaviors in the way that we think of them. They are behaviors that have a neurobiological function, which means the brain has a lot to do with why our kids do what they do. Some of their behavior, some of their flapping, their finger movements, the way they move their head, these would be actions that would change the chemistry of the neurotransmitters in the brain and help the brain come back into a zone that makes the child or the adult feel more safe in their own body. This is important for parents to understand because I think what is often the case is parents think these behaviors are a choice, an action that the child has willful control over, rather than the self-regulatory function that they play.
Hmm. So, you know, I mean, when I say this to parents or when I explain this to parents, parents are like, we know that it is a self regulatory mechanism, but we don't want our child to do it. So, I mean, what do we answer, and what is it that you would suggest to parents? It's more about um, appropriateness, maybe, or is it socially acceptable, not acceptable? How do they deal with such a if they feel what I'm thinking of?
Well, the only person you can actually change is yourself.
Mhm.
And as a parent needs to be in appreciation of the fact that they are triggered. Triggered means activated emotionally by a behavior that they don't like, that makes them feel uncomfortable. And so the true work lies in the very difficult job of acceptance, coming into alignment with what is. One of my very first patients, Reena, I shouldn't call her a patient, I should actually say one of the very first people that I ever met when I was a junior therapist at the Ayers Clinic as a student was Temple Grandin. And she was my assigned, first day client.
Mm.
And Temple Grandin is a woman who's very famous in the world of autism. And Temple Grandin could talk, and she could tell us, what is it like to live inside of a brain that is neurodiverse? And she would say things to me like, stop moving your lips, I'm trying to listen to you. Or, why do you have to wear that color of lipstick? It's so ugly. And what she was saying is, this is very difficult for my sensory systems to process. Your mouth moves and your sound is different. It's like watching subtitles.
Mm.
And so in that description, she would say, I need to look away from you in order to hear what you're saying. And she could explain that. So years and years, I've known her for 37 years. And one of the interviews that I heard her say recently was, a journalist asked her, would you like to have your autism cured? And she said, not a chance,
Mhm.
because I love my mind.
Yeah.
It's unique and different. And I want to have the mind that I have.
Wow.
So the question how do I get my child to stop actually tells me that the parent is sad, uncomfortable, in a state of evolution in the way that they are aligned with their child. And this is hard work.
Hmm. So for parents who ask me, what about self-stimulatory behaviors? I know they are for self-regulation. I know that you're doing therapy. Will they ever go away?
In my experience, over these many years, they change. And as the brain matures, many of the children that you and I treat are little. And as the brain matures, the need for body strategies for regulation decreases naturally.
Okay.
As cognition increases, as you get more brain, which is,
Yeah. Yeah.
typical developmental process,
Yeah.
there will be changes in how the brain needs that level of resource. But I have a young man in mind right now who is 14, and his intelligence, I will never be as intelligent as him in 5 lifetimes.
Oh.
But his anxiety level is so high because of what people think. And despite his social awkwardness, despite his sometimes need for use of his body to regulate himself, he is very sensitive. Sensitive to people's perceptions.
Mm.
And this is where the anxiety comes from. So that is a message to parents.